Hi, I'm Dr. Felice Gersh, your integrative OBGYN physician. I am going to chat with you about hormone replacement therapy, HRT, and breast cancer. First of all, does HRT cause or increase the risk of breast cancer? Now, actually, it depends on what you give. If you give the wrong hormones, you are definitely going to not get the optimal results. So let me go back and explain. But first, I just want to make it clear, the type of hormone therapy that I prescribe and the vast majority of physicians today is not, I repeat, not going to increase your risk of breast cancer, and in fact is most medically probable going to lower your risk of breast cancer. But let me backtrack for a moment to the Women's Health Initiative, this study that was ended over 20 years ago. Now, the formulation of hormones, and these were not human hormones. What they used was a combination of conjugated equine estrogens given orally. What conjugated equine estrogens means is that it's already gone through the liver to be altered, or what is called conjugated, so that it transforms this type of estrogen, which I'm going to tell you what it is, from a fat-soluble type to a water-soluble form, so it can go out with urine, which is like water, from the kidney. Now, what is this conjugated equine estrogen? It is derived from the urine of a pregnant horse that contains molecules, estrogens, that never exist in a human, plus it's given orally where it gets altered by the liver when it's swallowed by a human. And that's not even the bad part. The bad part is the pretend progesterone. The word that's used for that is progestin. The molecule that was used was MPA. That stands for medroxyprogesterone. I know it has the word progesterone in it, but it is not progesterone. It's an altered molecule that would never ever exist in a human body, and that was the source of the mild increase in breast cancer from that study, was only a little over 20%. By the way, many other things in life can increase the risk even greater than that. Nevertheless, that particular molecule was the source of all the uproar that came from that study. Now, what about the hormones that I use? They're not anything like those. What I use and other doctors is transdermal estradiol. Estradiol, the actual type of estrogen that is identical to that made by the ovaries of a reproductive age woman, and it's given through the skin. That's what transdermal means. So it doesn't go through the liver, it doesn't get altered and turn into a different molecule that actually has different effects in a negative way on breast tissue. And it's combined with progesterone. Progesterone, the exact identical molecule, our naturally made hormones, estradiol and progesterone, actually lower the risk of breast cancer. We didn't evolve as human females to make hormones that actually increase our risk of cancer and harm us. It is only when you give the hormones, these molecules that never exist in a human female, that you have a change in the outcome. It turns out particularly medroxyprogesterone acetate, which is an endocrine disruptor for progesterone. It is not real progesterone, and it actually interferes with the actual healthy function of our natural progesterone and blocks it in the breast tissue in such a way that it increases the risk of breast cancer. Now, let me talk to you more about what happens with natural hormones and what happens in a breast that develops breast cancer. So, how does breast cancer even develop? It turns out that all cancers are derived from an inflammatory process. Now, there are a variety of ways that inflammation can develop, and it can develop because you don't have the right balance of hormones, you don't have the right nutrients, your body has endocrine disruptors or other harmful chemicals, you have inflammation from chronic infections, short sleep duration, so sleep deprivation, chronic stress. So there's even more. There's a whole variety of things that can lead to inflammation. Inflammation causes DNA instability, can cause breakage of the DNA, misfolded proteins in cells. Most breast cancer developed from the ducts. Lobular breast cancer is less common. So all these cells in the breast, they have hormone receptors because they're designed to react to hormones. Now, it turns out that estradiol and progesterone are anti-inflammatory. Estradiol controls the immune system to keep it from going into a pro-inflammatory state. And remember, I said inflammation underlies the development of cancer. And I'm telling you that breast tissue has estrogen receptor function because it's involved with hormone functionality in terms of how it grows and is sustained. And the fat tissue, that is the tissue between the ducts and the alveoli, that fat tissue contains an enzyme that is turned on if you have inflammation, and that enzyme converts androgens into estrogens. So the breast has its own capability of making its own estrogen supply. Now let's go through this process quickly. If you have inflammation, DNA instability, damage to DNA, it turns into cancer. Now, if that cancer has estrogen receptor positivity, as most tissue in the breast does, and most breast cancers are hormone receptor positive, but not all. The ones that don't, they call them triple negative breast cancer. By the way, the ones that have positivity, the receptors, that means on the breast cancer, they have receptors that can bind to hormones, usually estrogen and progesterone. And what happens is if you have breast cancer that develops not because you have hormones, but usually when you don't have hormones, because you don't have that immune stabilization property present by the estrogen, estradiol made by the ovaries, or given to a woman endogenously or exogenously. Either you give it through the skin or you make it in your ovaries. If you have that estradiol and you have natural progesterone, it keeps inflammation down. But if you don't have it, you have inflammation up, and that can lead to the cancer. But if you develop cancer, everything is different. That cancer that has hormone receptors that can react, it can hijack the estrogen that's present and use it to increase its growth. So the estradiol does not cause breast cancer. But if you develop breast cancer in spite of having estradiol, or because you don't have it, or you take the wrong kind of hormones that actually facilitate the growth because you're using the wrong stuff, like what they used in the Women's Health Initiative, particularly the medroxyprogesterone acetate, and you get breast cancer, then you should not give hormones, because then the hormones can promote the growth. The estrogen that can grow breast cancer, when you have estrogen receptor positive breast cancer, can actually be made in the breast itself. So what happens? Breast cancer is extremely inflammatory. It creates tremendous inflammation, and this inflammation is in the tissue now surrounding the breast cancer. That tissue includes all that fat that's in the breast. The fat has the enzyme aromatase that can convert androgens like male-type hormones. Most of it is coming from the adrenal gland. It converts the androgens into estrogens. But what kind of estrogen? Not the estradiol, the kind that we would give you if you were in menopause, or the kind which is the same as what the ovaries make during the reproductive years. That's not the estrogen made. It's estrone. Estrone is a different member of the estrogen family, and estrone acts on alpha receptor. Breast cancer has alpha receptor receptivity. Estradiol works on alpha, beta, and membrane, but estrone that is made in the breast tissue itself, that's induced by the upregulation action of the enzyme aromatase due to the inflammation that is caused by the breast cancer. This estrone can bind to the receptor for estrogen on the breast cancer and promote its growth. So breast cancer creates its own estrogen supply in the breast, in the surrounding tissue, that promotes the growth of that breast cancer. That's why they treat postmenopausal women with the drugs that are called aromatase inhibitors, because they block the enzyme that is activated by the breast cancer produced inflammation that turns on this enzyme in the fat tissue, connective tissue, and so on, surrounding the breast cancer in the breast, to create its own estrogen supply, which is estrone, the estrogen that binds to the alpha receptor, which is the type of receptor that's on breast cancer. This has nothing to do with giving bioidentical estradiol and bioidentical progesterone that we give in menopause, especially when you give it in a cyclic way, where you give the estradiol every day continuously, but the progesterone is only given for 14 days of the month, to rather mimic the way a menstrual cycle would go, because when you give it that way, you're helping to turn on as well tumor suppressor genes, genes that replace the ability to downregulate the ability to create cancer cells. Estradiol also is anti-cancer because it promotes that action that is necessary, where yucky cells, sometimes they're called zombie cells, these old cells that can turn into cancer cells that create inflammation, those cells are supposed to kill themselves. And estradiol actually promotes that process that's called apoptosis. And it also promotes autophagy, which is intracellular renewal and helping the cell to stay healthy. It's so important to know that what they gave in the Women's Health Initiative when they did that study, which showed a small increased incidence of breast cancer, has nothing to do. It's like apples and oranges. It's like worse than that. The hormones that are given that are bioidentical support proper immune health, support proper health and regulation of cell cycles, cell health, reduce inflammation. When you give the proper hormones, that doesn't mean you can't get breast cancer. There's so many reasons why people can get breast cancer that predate. In fact, breast cancer, by the time it's found in a postmenopausal woman, it has probably been there for 20 years, and it's just now being clinically manifested. So breast cancer doesn't just grow from scratch in 2, 3, 4 years. It takes quite a while, and then it reaches a threshold and it may grow and become more clinically evident and discovered. So it's really important to understand the natural history of breast cancer. The causation is not giving human type bioidentical hormones. It is related to giving chemical endocrine disruptors. These are like evil twins, evil mimics of real hormones that are not designed in our bodies to harm us, but to sustain us, to give our immune systems the proper function. As we age, the vast majority of women who develop breast cancer are post-menopausal women who don't have hormones. Young women who have hormones can get breast cancer, but not because they have hormones, but in most cases because they have inflammation in their bodies. It's not because they have hormones, it's in spite of having hormones. Women after menopause who get breast cancer get it for all those other reasons, plus because they don't have those protective hormones. Somehow it got turned on its head. Our natural bioidentical hormones protect us from cancer. They don't give us cancer. And if we give them in a physiologic way, proper dosing, proper rhythms, they protect our immune system. They protect our breast tissue. They lower the risk of breast cancer. Don't be afraid of our own beautiful life hormones. They're not there to harm us. They're there to sustain us. But do be afraid of the chemicals that surround us, and even when they're in pharmaceuticals that are acting not as human hormones, but actually as endocrine disruptors. So you need to know what you're taking. All hormones are not the same. Only human bioidentical estradiol and progesterone, identical to what the ovaries make, given at physiologic levels, meaning replicating reasonably close levels that a healthy 20-something-year-old woman would have, and giving the progesterone preferably for only 14 days of the month to mimic to some degree how a normal menstrual cycle would be, to turn on and off receptors, to turn on tumor suppressor genes, to regulate the metabolism of the body, to take care of the immune system so it stays in a non-inflammatory state when inflammation isn't warranted. So if you have breast cancer and it's hormone receptor positive for estrogen or progesterone or both, then it is not appropriate to give the hormones because it could stimulate the breast cancer. It's important to know the difference between that situation and the causation of breast cancer. They're totally different. The hormones can grow the breast cancer that's already formed, not because of the hormones, but because of inflammation. It's a hard concept, but it's really important. Breast cancer is not due to being on or having bioidentical hormones. So embrace hormones that are identical to ovarian-produced hormones and not chemical mimics that are masquerading as human hormones. They're not. Be sure you know what anyone is trying to give you. Only take bioidentical and only use estradiol through the skin, transdermal. Thank you, and I hope that clears up some of the confusion about the role of HRT, hormone therapy, and breast cancer. Thank you.